All right, part 4 to pre-ACL surgery ideas, approaches, etc. So we started off and laid out some of the concepts. Number 1, we're looking at choosing a doctor, choosing a surgical approach, the timing of it. What do you suggest happens to go quickly? What can we suggest to go slow? We're going to look at the training approach, and we're going to look at nutrition. So nutrition is very, very specific. We're going to, as I mentioned earlier, we'll look at some other videos because these are things that I'm really thinking about a lot lately. But right now, let's look at the training approach. Most of the time, I'm in this particular perspective when we're looking at those young teenage females. These are very undertrained individuals. Doesn't mean they all are, but you don't usually see the ones that are highly trained having the same issues in terms of lower body injuries. Okay, so this is a great opportunity to teach them how to lift. We are going to be under a little bit of compromise if the knee does not allow us to do every exercise that we want or the intensity that we want. So we will have to approach this with lateralizations and regressions if need be. Okay, but I'm going to take if I have an opportunity with a very young training age, we're going to pick some things that are going to really target us in a very linear type of periodization. We should be able to increase weight every week. We could set percentages, etc., whatever it is, but we're going to do the same sets and reps each week, and literally the same exercises every day. There is some room for some decision making based on, again, does the knee get in the way of this of performance? And also, of course, what equipment is available? What do we feel comfortable with this happening? Remember now, in a lot of situations, the swelling is gone and you don't even know that the person really has an ACL. And just having compression of the femur into the tibia is a stabilizing agent unto itself. So when people talk about ACL is just good training, I'm not sure that this is a special program that I would only use in these contexts of an ACL injury. Any 15-year-old girl that didn't train, this is a place where they could start. And it's not as dense as others because I'm looking for certain things that I know is going to push our phase 1s of rehab. So we're going to choose 3 lifts. We're going to talk here, here, and here. And the general component of these lifts, A is going to be something knee dominant. All right. Now, when we talk about knee dominant, if we can't get there, we'll shift to something else. But we're going to try to, in a perfect world, get to a knee dominant. Maybe our ankle stuff gets in the way. Maybe knee symptoms get in the way. Whatever the driver of those symptoms are. B, we're going to get an upper body push. And in C, we're going to get a pull. And I don't call it upper body because in some versions of this program, you can get a squat here and a hip dominant movement here like a deadlift. We can just decide and get after where we're going to find value. Other types of pulls, not only do we have all of our upper body pulls, we have deadlift. You may also find your Olympic lifts. As we are focused on the posterior chain here. I do not expect somebody that just had an ACL tear and is 3 weeks away from having surgery doing Olympic lifting, but there is certainly things like a mid-thigh pull where it's completely isometric. You find the range where the knee is not fussy, and we get after it. Okay, knee dominant. If we can. Front squat, I think that'd be great. Goblet squat, I think that'd be great. Sometimes the knee isn't going to let us get there. Do we have any single leg activities? If we don't, we'll revert to a pull here. We'll make this hip dominant. And usually if we can maintain vertical tibia, we don't have those knee symptoms. So we lateralize out of that and we get it, and then we'll turn our C lift into an upper body pull. Okay, lots of different choices that we can make. They all just fit into, in this case, your functional movement screen or your selective functional movement assessment. Can joints get in the right positions to absorb, adapt to stress? If we go back to where my influence and how we're programming here is Bill Starr 5x5. It was back squat, it was bench press, and it was hang clean. So if I think of how I want to coach those movements, then I should know what the joints are that are required for what I'm going to say, that looks like good form. That's the whole idea of those movement evaluations. Can joints get in the right positions to absorb, adapt to stress? But that only works if you talk about what are the exercises that you want first. If you run one of those evaluations or other models, you kind of get stuck and you wind up with something that may not be as stimulative or developmental as really possible. Think of what you want first and then work backwards off of your evaluation. So we're going to get into this here. Now we're going to set up what is at least a 3-day program with those lifts. So you're going to pick your A lift, which is your lower body, probably in this case hip dominant, but we started off with a squat. Your upper body push, let's call it bench press, and C is going to be pull-ups, inverted row, something that you can get very, very heavy, all right? So clearly we're going to have our warm-up up here. We're going to have some accessory movements here, particularly getting another opportunity to get after the quad, maybe with a terminal knee extension, maybe with a backwards sled push if they can do that. We're also going to look at glute ham raise or rigging a 45-degree extension to get into glute ham raise. But ultimately, we are looking at 5 sets of 5 on our heavy day, and none of this came out of my head. This is all for intermediate level Bill Starr 5x5. We're going to use it for somebody even less experienced than that here. So this is going to be very close to 80 to 90%. If we're getting 5 reps, probably shouldn't be getting over 90% the way I'm describing the percentages. But if we use it a different way, it should be 100% your 5 RM. I'm not looking for 6 reps. This is a young individual. They should be able to bring the heat. They don't have sport practice. They're going to be eating that we talked about in the first video. We're going to get after it for 3 exercises. We can decide where we go using the repetition method, probably creating a circuit, all right, for some of these other movements. Certainly you can get arms. Anything else that you want to do, you put together down here, but we're going to get 8 to 12 repetitions. We're training them as if their job is to lift. Number 2, we're going to drop down to 60% plus. If it's really awful and we're not getting great movements, then we can make it a little bit heavier, where we're looking at 4 sets of 5, 4 sets of 5, 4 sets of 5. And then for day 3, we're going to try to get somewhere in the middle, 70 to 75%. We're going to go 3 sets of 5, 1 set of 3, 1 set of 8. 3 sets of 5, 1 times 3, 1 times 8, 3 by 5, 1 times 3. This is totally Bill Starr. I found on there's Excel sheets that you can look up to find how we can plug in numbers where there's certain percentages that basically your 3 in week 1 becomes the next 5. Now, you're getting 5 sets of 5 that are escalating. You're not hitting every set at this high 90%. But your last set of 5 would be the week before your set of 3. So you're in a very, very strict linear periodization, which I don't think is a problem when we're talking about this type of younger, undertrained individual. All right. So your exercise selection is just, again, based on what the knee allows you to do. Now, if there are still other exercises, because a lot of people get fussy, well, it's only 3 exercises because they're so used to having this very functionally dense A1, A2, A3. There's nothing wrong with that, but I don't think that is the best approach for strength and hypertrophy. That is maybe a better approach after this athlete comes back from their ACL, but I don't think it's the best approach. I'd rather be much more functionally myopic in what we're going after, because I don't need all of those other skills. I'd rather get after what I do need that's going to help them recover, and then get them to those checkpoints so they can be basically stronger at in a global sense. Not just the muscles strong, they can move more weight. The entire body will be stronger if we can focus on less things at this point in time. But if we run other days through here, you can put all your other exercises there, and you can run circuits. You can run an aerobic circuit where basically these exercises are much less demanding here. Remember, you've got this built-in high, low, medium. If we get another medium lows in there doing other things, or whatever type of conditioning, maybe it's the pool, if the bike works with the knee, you could throw ropes if we're trying to get away from the knee, the upper body for the airdyne, all of these things we talked about in ACL in action, where that's all going to be your primary options, particularly in the first month or longer. Maybe not. It depends how well you get out of surgery and how well the surgeon did their work. Okay? But this is where our training program is going to go. If it doesn't look exactly like this, let's get that focus on using a lot of the same exercises over and over again, whatever you think are the meat and potatoes of that athletic development program. Because you may find that if you turn A, B, C into A1, B1, and C1, you have the foundation of how you could start to add other things to create that functionally dense program that a lot of people are familiar with. But you're not a bad person if you're a little bit worried. Well, it's only 3 exercises. We're looking to create systemic changes. We're looking to create lots of values that are going to help us get out of surgery faster. I don't think the concurrent program is the best program to do all of those things. So this is the training program. We're going to add some other things. We're big on getting extra work on the quad. We're big on getting extra work on the hamstrings. We can get after the sled, ab and adductors, anything that the knee can tolerate. We can get some curls, we can get some triceps work, and certainly anti-extension and anti-rotation. So if I create a D that has a quad, something to focus on the quad, terminal knee, something to focus on the hamstring, glute ham, tricep push downs and planks, and then I start to toggle around with those 4. We just go around 3 or 4 rounds, rest as much as you need. The less CNS intensive stuff we can create there, and then we can add another 4 or do other types of conditioning on the other days. You run into surgery with this. Again, like we said earlier too, I'd love to see almost 2 months of this, because those 2 months might buy you back 4 at the end. Maybe you're cleared way before that, but you're really at a much higher clip, a higher pace of how you're being able to tolerate and adapt to the stress of training. So this is the training program. So we talked about what we do beforehand. We just used the navicular as an example of how we can support the mechanics. We looked at the exercises that relate to the navicular. You can substitute a whole lot of things in that. As you can see, the way we're going to try to run these videos is you're going to tell me what those things are. If I don't know how to do it, I'll say I don't know how to do it. If I say it's irrelevant, I'll say it's irrelevant. But I'll show you how we looked at it when somebody said, what would you do to increase ankle dorsiflexion? We took the exercises there to show how to support the mobilization and how to get some stabilization of the navicular, and then we put together our training program. Put all these together, watch them all in a row. It applies to a lot of things. I think after a while we'll probably start to see that these videos really just illustrate a thought process, and I'm just cherry picking and choosing little components that we'll share, but you're going to be the ones that select the topic, and I'll run with it the best that I can. All right. Additionally, when we look around and try to find new ideas and new concepts, if you can find a leprechaun, say, yeah,